What is health? And yes, you can achieve optimal health. Medical Wellness Archives, defining optimal well-being. According to the World Health Organization, health is defined as a state of optimal well-being, not merely the absence of disease and infirmity. Wellness practitioners believe that optimal well-being requires a balance between wellness dimensions that comprise the whole person. These dimensions of well-being include physical, mental, emotional, environmental, spiritual, and social components. This integrated perspective of optimal well-being recognizes the importance on each dimension as well as their gestalt. An individual's well-being and vitality is greater than the sum of his or her parts. Although this concept has been around since Hippocrates, it seems to have been lost with the rise of conventional medicine and its reliance on specialization, technology, and separating the disease from the person. Today, a paradigm shift is taking place as evidence-based medicine and complementary approaches are integrated into a total treatment regimen. In 2000, the World Health Organization released a report ranking healthcare systems around the world. The United States healthcare system came in 15th in overall performance and first in overall expenditure per capita. That result meant that its overall ranking was 37th. The World Health Organization has adopted the following definition of health: a state of optimal physical, mental, and social well-being, and not merely the absence of disease and infirmity. Do you believe you are healthy if you have no symptoms? Do you know the first symptom of heart disease for 40% of those with heart disease is a severe or fatal heart attack? By the time symptoms are present, the body has lost the ability to function properly. Yet society believes in creating the removal of symptoms with medications. The suppression of symptoms and function does not mean the problem has been eliminated. Health can be achieved and maintained when you shift your efforts towards creating optimal function in your body and not simply removing symptoms. Function is any of a group or related actions contributing to a larger action, especially the normal and specific contribution of a bodily part to the economy of a living organism. Trauma is defined as an injury, such as a wound, to living tissue caused by an extrinsic agent. Organ is defined as a differentiated structure, as a heart, kidney, consisting of cells and tissues and performing some specific function in an organism, bodily parts performing a function or cooperating in an activity. Organs control all of the body functions. You can only have good health when all of the organs of the body are properly functioning. If organ function is decreased, you will have a subsequent loss of health. For example, if the stomach is not functioning properly, you may have some gas, bloating, or heartburn. Kidneys or gallbladder may develop stones. Certainly, if a bone breaks, it has lost function. What is function? It is important to know that when function is partially lost, symptoms may not develop for days, weeks, months, or even years later. If the heart loses 25% of its function over time, the first is trauma-based before the body will experience chest pains, chemical heart exposure, or emotional. Trauma. Any of these will affect the normal function of your body. A physical trauma could be from a fall or a cut. Chemical exposure would be if you come in contact with a substance by ingesting or inhaling. Emotional trauma can come about after a life-altering experience, such as a loss of a loved one, physical or sexual abuse, etc. With emotional trauma, it'll affect the brain's serotonin levels, altering its function. As a result, a person may develop depression, eating disorders, disturbed sleep, or other mental illnesses. The next way that loss of function develops is because the body is more susceptible to infections. When your resistance is down, it will be open to catching colds, flu, pneumonia, etc. Only if your body is not functioning normally. If proper function would prevent an infection, then restoring proper function would be a major factor in eliminating infection. The next way would be a functional loss or direct loss. These are conditions that are considered to be incurable. Asthma, diabetes, infertility, eczema, colitis, etc. These and many others may respond favorably to a treatment designed to restore the body's function. Acupuncturists have been restoring normal function to the organs for centuries by simply removing blockages that prevent the free flow of blood and energy to the organs. Relief or correction? Which do I choose? Relief care may be used by a runner who sprained an ankle while running. If it was leg pain from an underlying condition, then corrective care would be necessary. With corrective care, the goal is to rid the body of the symptoms or pain while correcting the cause of the problem at the same time. It will vary in length, but the results will last longer. What is relief care? It is a temporary relief of symptoms. The only reason someone chooses relief instead of correction is because they don't understand the benefits. Corrective care will cost less over time by achieving permanent results. What is corrective care? The body's organ function increases, allowing the body to heal itself and adapt to the stresses of life. You start to feel better. The circulation of blood and energy is optimal, thus greatly improving your overall health. To accomplish correction, your acupuncturist will analyze your individual needs and develop a plan to help you reach your goals. As you progress through the plan, we will regularly check your body's progress. Progress. How do I know when I'm there? There are many ways to measure progress. Your symptoms will come and go, therefore not an effective measure of correction of your problem. To consider the injured area corrected, authorities say a person's symptoms must be gone and not return for at least 12 months. To reach this goal, we will check you regularly to see that your organs are becoming more balanced and that the energy and blood circulation is improving. We will keep you up to date on your progress. How long do I have to come? If your body's function is optimal, as shown on your patient progress graph, we will reduce the frequency of your visits. This graph shows your body's function objectively. We will go over this with you at an upcoming visit. Relief care would be the equivalent to taking an aspirin for a headache. Although it may temporarily alleviate the headache, it does nothing to correct the cause. Corrective care focuses on making certain the organ malfunction and improper blood and energy circulation, the causes, are corrected, and therefore the headaches, the result, are gone. The difference between relief care and corrective care can be illustrated by the following. Let's say your house is cold because your furnace is not producing heat. For relief care, you could buy an electric heater which would take care of your immediate discomfort. In the long run, however, running an electric heater is both less effective and more expensive than fixing the furnace. Correction would have been to simply fix the furnace. Although it may have cost more initially, it would save you money in the long run. How long does corrective care take? If correction is possible, it normally takes a period of intensive care, anywhere from 2.5 to 7 months, followed by a period of stabilization. Correcting a person's health problem is similar to pouring cement into a mold. If you remove the mold before the cement hardens, you lose the object you wanted to create. Not everyone can reach complete correction. Sometimes a person's problem has reached a point making complete correction impossible. Your acupuncturist will inform you of the severity of your problem and if correction is possible. If complete correction is not possible, then a program to bring your health up to its greatest potential will be explained. After the intensive phase of corrective care, visits of once every 2 weeks to once every 2 months are necessary to hold your function in place until it stabilizes. As cement requires time to stabilize, so does body function. Your acupuncturist can best determine your individual needs. Research shows that symptoms are the last thing to show up, but the first to go away after correcting the underlying cause. Continuing care encourages your body to heal completely and faster than on-again, off-again treatments. Prevent a relapse. Without continued care to offset the mental, emotional, and chemical stressors of life, your body may return to its unhealthy state. Part of the corrective care phase retains and stabilizes proper organ function and proper blood and energy circulation. Following all the recommendations your acupuncturist makes, including dietary, lifestyle, etc., will ensure a relapse does not occur. Maintenance care. The Emperor's Plan. This is the type of plan that will give you relief, elimination from underlying causes of your health concerns, and help you maintain that incredible level of function far into the future. How does health maintenance work? It works to remove the cause of the problems before symptoms arise or serious conditions show themselves. When should you start? As soon as corrective care is complete. Regular re-examinations will determine the need for maintenance care. Who needs health maintenance? Everyone who wants the most out of life. Health is vital in order to be happy. Your acupuncturist estimates the number of visits you should need per year, usually from 4 to 16. Re-examinations, performed every 3 to 6 months, will be included. To help you receive maintenance care, your acupuncturist has several budget programs. If an accident or crisis arises, relief care and corrective care become necessary. Your maintenance program will be temporarily halted, and we will treat you more intensely until the problem is resolved. Congratulations on making acupuncture your choice for healthcare. Health is vital in order to be happy, and here at Goldfish Acupuncture, we offer natural solutions for optimal health.